Kia ora, my name's Isis and I'm the General Manager at Women's Health Action, and I'm so pleased to have Michelle Wise here with me today. Kia ora, Michelle.
Kia ora, Isis.
So you're the first person that we've talked to in what will be a series of interviews looking at aspects of maternal and child health care during COVID-19. And as you know, Women's Health Action recently conducted a survey looking at a wide range of information and support needs for those who are pregnant and caring for infants and young children during COVID-19. And today we're going to have a chat with you about obstetric care and other pregnancy and birth related issues during this time. So I thought maybe we could start with you telling us a bit about yourself and what you do.
Sure. So I'm an obstetrician and gynecology specialist in New Zealand. I work in Auckland. And you can hear from my accent that I was born and raised and trained in Toronto, Canada, but I've been in New Zealand for about 10 years, working at the University of Auckland, involved in research projects and teaching medical students and working clinically, of course. I do both obstetrics and gynecology. And I guess, yeah, I'm happy to answer questions about maternity, working with RANZCOG, which is the Obstetricians College here in New Zealand, and helping to allay some of the concerns that we're hearing from our pregnant women.
Cool. And so you don't actually have like a caseload or a group of women that you see on a regular basis, do you? But you see probably heaps of people coming through the hospital, I imagine.
Exactly. Yeah. I work only in the public sector, and basically every woman who's under the care of a midwife, if there's any complication during the pregnancy or during the labor and birth, they will consult us. And so I end up meeting lots and lots of women for much, much shorter periods of time at some point during their pregnancy and birth.
Cool. So as I mentioned just before, we've been running this survey and we've learned some things from the 350 responses so far. And I thought I'd give you a little bit of detail about some of those things, and then we might have a chat about some of the questions that have been brought up specifically related to your area of expertise.
Sure.
So we found that over 47% of the respondents who completed the survey are currently pregnant with their first or subsequent child. That over 50% of the respondents felt that they had not had access to information about pregnancy, birth and caring for babies during COVID-19. Over 41% reported that their plan or their birth plan, or where they plan to birth more correctly, had changed due to COVID-19. Over 58% of respondents are planning to birth in hospital. Over 24% are planning to birth in a primary birthing unit, and over 12% are planning to birth at home, and a small percentage of those are undecided at the moment. Over 36% of respondents had not been able to access antenatal education at the time of responding, and 63% of people felt that their antenatal care had been adequate despite COVID-19, and 36% felt that it had not. And, you know, not surprisingly, most people were really worried about things like who was going to look after their children at home when they were giving birth. And you know, there were many other sort of thoughts and questions that came up, but thought we'd just give you a little sense of, I guess, where some of these questions are coming from and the wider sort of thought processes of these people.
Sure.
But before we talk about those, I was wondering if we could talk about some sort of, I guess, some brief information about the evidence relating to the risks associated with COVID-19 and pregnancy, or for pregnant people. And I get like things are changing all the time, so it's I guess what we know now. Yeah.
So at the moment, the science behind COVID-19 and pregnancy is based on research and experience coming out of other countries. We don't yet have any information yet from New Zealand, so this is based on overseas experience. But what it's starting to look like is that pregnant women are not more likely to contract COVID-19 compared to another adult. And we also know that pregnant women do not appear to be more symptomatic than average adults. So that I think is really good news and really reassuring for pregnant women. That's quite a bit different to influenza. So, for example, the reason we prioritize pregnant women for getting their flu shot every year is because with influenza, they are more likely to get more unwell if they were to contract influenza during pregnancy.
Okay.
So it is a bit different in terms of the microbiology and how the virus works. It's much more similar to other coronaviruses such as SARS, and a little bit different from influenza.
Oh, cool. That's really helpful. And I know that the Ministry of Health have developed some information, particularly relating to COVID-19 and pregnancy, and we could probably put that up, you know, at the end of this interview, maybe.
Yeah, that's a really good idea. I think what's adding to people's distress around this is getting information from so many places. And in pregnancy, at the best of time, you end up with a lot of unsolicited advice from all sorts of people, and then it's amplified by social media. So I think it would be great if you could direct pregnant women to really good and reliable sources of information. So obviously the COVID-19 Ministry of Health site is excellent and it will answer most questions. And I would also support people going to the RANSCOG site. The very first thing to click on the homepage is information for pregnant women about COVID-19, and that's based on the College of Obstetricians.
Cool. We'll definitely share that link along with the ministry one at the end of this interview. So maybe we'll have a bit of a chat about some of the specific concerns that people raised on the survey that I thought would be good to talk with you about. And I'll just run through them and we can see where we get to. So people wanted to know what happens if their midwife needs to refer them to an obstetrician, and how will that appointment look, and how might that look different to how it usually looks? Because I know that sometimes some of those referrals are just done over the phone in sort of normal times anyway.
Yeah, that's a really good question. I know that the Ministry of Health has said quite clearly that pregnancy care is an essential service. So the easy answer is to say that all of the maternity care is being provided as it usually is. The difference, I think, is going to be in how it's delivered. So, for example, in my hospital, I review all the, or there's a group of us that every day review all the referrals that come in from midwives, and we check their ultrasounds or blood tests or whatever it pertains to the referral. And then we have a few options. One is we just send a note back to the midwife with our advice, and then ask the midwife to relay that information and make a plan with the woman. The second option is, if it's suitable, then we do a consult directly by ringing the woman at home. So in fact, it saves the woman from having to come in just to chat with an obstetrician. So I think I've had really good responses so far when I've rung women and said, hey, it's Dr. Wise calling. I'm wondering if you'd like to do this call over the phone. And they're usually quite happy to do that.
And that's even without the COVID in the picture.
Well, I never used to do that before. We used to have huge antenatal clinics. And so I actually really enjoy the one-on-one interaction myself. And the third option, of course, is if the woman needs an examination, then obviously it's appropriate for her to come in and have a proper in-person consultation. And the modification there is that we're trying to make it a bit shorter. So we're trying to socially distance our women from each other in the waiting area. And then when we come into the examination room, we're sitting 2 meters apart and having a chat, and then minimizing the closer contact to check your blood pressure or measure your fundal height or listen to the baby's heartbeat. We're trying to shorten that time to less than 15 minutes.
Okay, cool. That's really good. That makes sense to me. Another person was wondering if they had cramps or bleeding or other complications during pregnancy, and their midwife tells them to go to the hospital. And I know this will differ from place to place, but if they ended up in the women's assessment unit or emergency department, how might that look?
Another really good question. I think that the usual things apply. I mean, these are common scenarios that occur in the second half of pregnancy. And the first thing women should do is ring their midwife. And then if the midwife is concerned, then she can either visit you or examine you herself, or she would ring the hospital and speak to the obstetrician on call. And we are available 24/7 to offer advice over the phone to midwives. And again, if a woman needs to come into hospital, then she will. We are all there 24/7. We have very experienced, very caring and compassionate midwives and doctors who are available to examine patients if that is the most appropriate course of action. Again, one of the differences, sorry to interrupt, one of the differences is that you end up being pre-screened over the phone with the questions about if you're feeling unwell. And if it doesn't happen in advance, it will happen when you first arrive at the hospital. And that's a difference because I think people aren't used to that. And what we're trying to get the message across is the reason for asking the questions is to just pause and think, right, where is the best place to see this patient? Let's make sure she's in a private room. Do we as healthcare workers need to put on PPE? I'm sure you heard a lot in the news about personal protective equipment. So do we need to put on a mask? So it's not about keeping you out or denying you the care. It's about making sure it's in the right place by the right person and giving us a moment to protect ourselves as well as your midwives and doctors.
That makes sense. I think people are scared that they'll, somehow be turned away. And it's really, I think, reassuring for people to know that although it might change the way that the care is provided, that the care is still there and everyone's going to still be there. We had a few questions about cesarean sections and what might happen in the case of things like will elective cesarean sections be cancelled due to emergencies? And I mean, you're the expert, but I know that happens anyway, regardless of COVID-19. If there is an emergency situation, that there might be delays. But what's your sort of thoughts on that?
Yep. So again, it would depend on each hospital managing this a little bit differently. It'll depend on the size of the hospital and how many theaters they have and how many surgeons they have to perform cesareans. In the larger hospitals, there's usually one theater for planned cesarean section that will carry on running, regardless of what's happening as an emergency, and a separate one to take on any sort of emergency or unplanned cesarean during labor. But yes, I think that we are trying to ensure that the service runs smoothly, and we're doing a lot of preparation in advance to manage our emergency cesarean in the face of a woman who might be suspected case of COVID or know that she's actually positive for COVID. So we're running a lot of simulations so that that process is all smooth with the woman getting the care she needs, but allowing time for the healthcare workers to put on their PPE. So that's how we're preparing so that we're ready for that inevitable situation. That's what we're hearing from overseas. So yeah.
Cool. And there are obviously more questions around cesarean sections. People wanting to know that if their partner can't come into theatre with them, would there be someone available who might be able to take photos or videos or that sort of thing, that's something that the partner might do?
I think it will be hospital dependent, but I can reassure everybody that at every hospital, there's always a midwife, an anesthetic doctor, an anesthetic technician, the obstetrician doing the surgery, and at least 2 or 3 nurses in the room. So that's the same. We're all very experienced, very caring healthcare practitioners that are there to look at, it's our only job is to look after you and look after the baby during a cesarean section. And as to taking photos, I guess, I don't know the answer to that, but I think that would be a nice thing to do. So if somebody did have an extra hand and they didn't mind, I think that would be lovely. But I guess it would depend on hospital policy.
Yeah, absolutely. And maybe that's something that people could talk to their obstetrician or their midwife or about prior to
in advance.
And say, so they could make a plan and have their expectations in place before they're in that situation.
Sure.
Obviously that can't happen all the time in emergencies, but People also wondering about help with their baby post cesarean section while they're in hospital, if their partner can't be there, and having trouble with lifting baby and things like that. Again, I'm sure that there'll be staff on hand, but yeah, how does that look?
It's a real challenge, and we really acknowledge that that first 24 hours and the first 6 weeks having a baby is the most joyful, wonderful time, but also, of course, practically speaking, difficult. You've got a brand new newborn, you're learning how to manage, how to breastfeed, how to, I've had 2 kids. I know how that can be a real challenge. So yes, we are asking people to really just trust that the midwives and the doctors are in the hospital. They are looking after you, and we do acknowledge that it's hard, so hard not to have a support person with you, but it's really for the greater good, and it's just a really difficult time for all of us. It's not easy for us either. And we recognize that it's a concern. Once you get home, I think that the most helpful thing is to really focus on looking after yourself and your baby. Do all the usual things to keep yourself in good spirits. So things like getting enough sleep, sleeping when the baby sleeps, making sure you're drinking and eating. Make sure you get outside every day for a bit of fresh air, go for a walk. But it is important to stay home and stay in your bubble. But that's a challenge too. You can imagine that first 6 weeks, normally there's heaps of people coming over to visit and holding baby for a wee while and doing some groceries and doing some meals. So we acknowledge that that's going to be a bit more challenging as well, staying in your bubble.
Yeah. And I guess this sort of flows on from that. And I feel like you've sort of pretty much answered this already, but that people are worried that the staff are going to be extra busy and that they're going to be too busy, maybe noticing that they're having a problem and that they might receive less care than usual. And I think you've reiterated that throughout this chat, is that all the care might look different, but the care is still there, right?
Look, the numbers are the numbers. So the women who are currently pregnant and planning to birth, we don't expect any increase in the workload. So we're the same number of healthcare workers and the same numbers of women planning to birth. So I anticipate that actually that I can be very reassuring that we have all of our systems in place to monitor women. And if we suspect that anything is of concern, it gets escalated appropriately, and that should carry on absolutely the same.
Okay. Yeah, that's really great. And just another question, sort of stepping back a few steps, I think, which is if someone was worried, and we sort of covered this off in regards to the earlier question around bleeding and cramping, but if people are worried about something during their pregnancy and they feel like they want a checkup or an extra checkup, can they come into the hospital and see someone if their midwife isn't available to see them in person?
Oh, that's a great question. I don't know how to answer that. I think the primary point of contact for anybody at any time is their own lead maternity care, their own LMC. And I would like to think that LMCs are still taking phone calls and responding appropriately to their women. And even if they themselves can't see the woman, they certainly have, this is all set up already. We have really good communication with midwives ringing into the hospital and being able to access the doctors. I mean, that's what we're there for. And that's when I'm on call, that's all I do is I answer phone calls from midwives all over the city asking questions about their women. And sometimes we agree over the phone that they should come in for assessment. And that, again, will continue just exactly the same.
Yeah. So I guess that's really about sort of trying to get women to speak really clearly and transparently to their midwife about what it is that they're worried about, so that their midwife can follow those pathways and can get in touch with the likes of you and make arrangements to check up on anything that is worrying. People should feel confident to keep in contact with their LMC like they usually would.
Yeah, that would be very good advice.
Cool. And finally, people are worried about coming into the hospital and potentially contracting COVID-19, either themselves or their baby while they're in hospital. And I guess the discussion that we've already had around PPE and making sure that you're protected and they're protected sort of covers off some of that. But have you got anything to offer in terms of reassurance around the protections and the hygiene and those sort of precautions that are being taken at the moment?
Well, I can tell you that all staff are absolutely washing their hands a million times a day. We're all keeping our 2 meters social distancing apart, even within the hospital setting, with all patients being pre-screened or being screened on arrival for if they have symptoms or a recent contact or recent travel, all the usual questions that are on the Ministry of Health website. I'd like to think that the people that are screening positive are being put into isolation, and the people that aren't. And so I don't think that people should be afraid to come into the hospital in case they get the infection. At the moment, the Ministry of Health is reporting each day the proportion of cases that are related to travel or related to a contact versus community transmission. And this is definitely going to change as the weeks go along, but at the moment, the risk of community transmission is quite low. And so I don't think women have to be worried about getting infected from being in the hospital.
Sure.
I think everyone is taking the usual precautions of hand hygiene and social distancing, both us and patients.
Okay, well, that's really about it for the specific questions that we had for you. And it's been so awesome to chat with you. Was there anything else that you wanted to say? Any questions you had for me? For any other messages that you wanted to sort of give to women that you haven't already given? You've certainly been comprehensive and really knowledgeable. Yeah.
Well, thanks, Isis, for the opportunity, because we are really hearing a lot of anxiety coming through from our pregnant women. It's a time that people are uncertain and anxious anyway, and I can only imagine the additional concern in this unprecedented time. And I think women can be reassured that that from our perspective, we're providing the same quality of care. It just looks different. We still want women to have a healthy, enjoyable pregnancy and doing all the usual things like taking their vitamins and all the usual things. And I guess the additional advice would be to get your flu shot. Pregnant women are a priority group, so you can ring your GP up and find out how to go about getting your flu shot. That's really important.
Oh.
Just stay safe, stay well, stay in your bubble.
Thank you so much. And we'll put up some of those other links that we talked about at the end of the video so people have easy access to that.
Great.
Cool. Thank you. We'll talk to you soon.
Pleasure.
Bye.
Bye.